Hello, Chapter 17, Substance Abuse. When you open your PowerPoint from the File tab, you can click directly on the link to watch this video about substance abuse. Please do so. So, as far as substance abuse is concerned, we have opioids, we have different classes of drugs under substance abuse. We're going to talk about opioids, which include heroin. Heroin is injected, or they call it mainlining or skin popping. You can also snort or sniff heroin, and it can also be smoked. It causes a brief quote-unquote rush, followed by a few hours of a relaxed, contented state. Large doses can stop respirations. Opioid drug withdrawal, your peak period is 1 to 3 days. Duration lasts about 5 to 7 days. Signs of withdrawal are drug seeking, mydriasis, diaphoresis, rhinorrhea, lacrimation, diarrhea, elevated BP, and pulse. Symptoms include intense desire for the drug, muscle cramps, arthralgia, anxiety, nausea, vomiting, and malaise. Medications such as opioid antagonists may be used. Must be free from opioids for 1 week. These drugs block opioid receptors so that euphoria is not produced. Must have concurrent counseling as part of therapy. Other medications used for treatment include clonidine, which is typically a blood pressure medication, and methadone. We have stimulants, which include amphetamines, cocaine or crack, methylphenidate or Ritalin, methamphetamine. You have MDMA or ecstasy, and there's others. And these are often known as quote-unquote designer drugs. Methamphetamine is stronger effects than amphetamines. They're usually in a pill form. A powder form can be snorted or injected. And then you have a crystallized form of amphetamines. They call it on the street ice crystal glass or crystal meth. It is smokable. It's more powerful. Sales of over-the-counter Sudafed or pseudoephedrine are now regulated because of the meth labs that we have that we're all aware of. Cocaine comes from the leaves of the coca plant, can be snorted or injected intravenously. It's highly addictive, physical and psychologic dependence. You can have a powdered form, which on the street it's called dust, coke, snow, flake, blow, and girl. Or the crystallized form, which can be smoked. And street drug is known as crack, freebase rocks, or rock. Stimulant withdrawal signs and symptoms. You have a peak period of 1 to 3 days. The duration is 5 to 7 days. Signs are social withdrawal, psychomotor retardation, hypersomnia, hyperphagia. Symptoms include depression, suicidal thoughts and behavior, and paranoid delusions. Stimulant overdose. Death results from convulsions, coma, or cerebral hemorrhage. May occur during periods of intoxication or withdrawal. Depressants, we have drugs that relieve anxiety, irritability, and tension, benzodiazepines and barbiturates, and we also have marijuana, which is often referred to as pot, grass, or weed. Another depressant on the market is, or on the black market I should say, is flunitrazepam or Rufinol. It is a benzo. It's often referred to as quote-unquote roofies or the date rape drug. It's used to enhance a heroin high or to ease coming down from a cocaine high. Use with alcohol produces disinhibition and amnesia. So this is why this drug is often put into a person's drink if they're going to use it as a date rape drug. Depressant withdrawal, peak period, short-acting drugs, 2 to 4 days. Long-acting drugs, 4 to 7 days. The duration for short-acting drugs is 4 to 7 days, and long-acting is 7 to 12 days. Depressant withdrawal, so our signs are going to be increased psychomotor activity, agitation, muscular weakness, diaphoresis, delirium, convulsions, elevated BP, pulse, temperature, and tremors of the eyelids, hands, and tongue. Symptoms of withdrawal are going to include anxiety, depression, euphoria, incoherent thoughts, hostility, disorientation, hallucinations, suicidal thoughts, and others. Depressant overdose. So if you mix benzodiazepines with ethanol or barbiturates, it can be lethal. Death results from respiratory arrest. And flumazenol may be used to reverse the acute sedative effects of benzodiazepines. Alcohol, more accurately known as ethanol or ETOH. You can often look up a person's ETOH level in their labs. Causes CNS depression. Few legitimate uses of ethanol and alcoholic beverages. Used as a solvent for many drugs. Alcohol does depress the CNS system. You may have respiratory stimulation or depression. Vasodilation, producing warm, flushed skin. Diuretic effects. Chronic use can lead to nutritional and vitamin deficiencies, especially your vitamin Bs and thiamine. You may also see a person with chronic use suffer from Wernicke's encephalopathy, Korsakoff's psychosis, polyneuritis, nicotinic acid deficiency, encephalopathy. Also, they can suffer from seizures, alcoholic hepatitis, progressing to cirrhosis. So for severe alcohol withdrawal, this is what we call delirium tremens. The systolic BP is greater than 200. The diastolic BP is greater than 140. Pulse is greater than 140 beats per minute. Temperature is greater than 101 degrees Fahrenheit. You're going to see the person will not be able to sleep. They will be suffering from insomnia. Very much they're going to have tremors, and they will be for sure agitated. Benzos are the treatment of choice. You're going to use Valium or Ativan or Librium. So diazepam, lorazepam, or chlordiazepoxide. Dosage and frequency depend on the severity. So most of the time in the hospitals, if you are admitting somebody that is going into alcohol withdrawal, if you're keeping them there at the hospital, if they're suffering from a medical problem, you're going to have to keep them out of alcohol withdrawal with one of these medication regimens. Most of the time, facilities, and every facility is different, they have a scale that you'll use to assess the patient's symptoms, and based on the symptoms, that's how the doctor will dose one of those medications out to keep them out of withdrawal. For severe withdrawal, monitoring in an intensive care unit is recommended. If you can medically clear a person that's entering any type of withdrawal, whether it's alcohol or drug related, we try to place them into a psychiatric unit as soon as possible so that they can get the appropriate treatment. We'll also use antabuse or acamprostate, prostate, that's one of our newer treatments, and then we always are going to do in conjunct with a medication treatment, we're going to provide counseling, individual and Alcoholics Anonymous. Nicotine, many smoke to quote-unquote calm their nerves. It releases epinephrine that creates a physiologic stress rather than relaxation. Tolerance does develop. Physical and psychological dependency is associated with nicotine. Withdrawal symptoms occur if stopped, and there are no therapeutic uses for nicotine. Nicotine withdrawal is manifested by cigarette craving, irritability, restlessness, decreased heart rate, and BP. Cardiac symptoms resolve in 3 to 4 weeks, but cigarette craving may persist for months to years. We do have transdermal patches and nicotine gum systems that are available. We also have Zyban or bupropion that can be prescribed in the aid of smoking cessation. It is nicotine free and it is sustained release. A lot of people have had success with Chantrix as well, and this stimulates the nicotine receptors. Abuse of over-the-counter drugs in adolescence. So products containing dextromethorphan, high doses in a quote-unquote high accompanied by hallucinations, may cause nausea, hot flashes, reduced mental status, dizziness, seizures, loss of consciousness, loss of coordination and balance, brain damage, and death. And then we have huffing. I don't know if you've heard of this or not, but if you haven't, Google it or look it up on YouTube so that you can see some videos of what our adolescents are doing. So they're inhaling basically volatile solvents like nail polish or paint thinner, aerosols like deodorants and cooking spray, and gases like butane cigarette lighter fluid and nitrous oxide.